In this section, we'll be continuing with our Blue Cross Blue Shield claim, but we'll be looking specifically at items numbers 14 through 23. When we look at item number 14, this is the date of the current illness, injury, or pregnancy. When we fill this date in, this is when we put in when did the symptoms first begin, when did the patient start having problems, or in the case of a pregnancy, we need to put and indicate the first day of the patient's last menstrual period. If we know those dates, then we're going to put them here in box 14. If we do not know what those dates are, that's all right. We can leave box 14 blank. Item number 15 is where we indicate whether or not the patient has been seen before previously for this particular condition. If we know what that date is, if it's indicated, then we can go ahead and we can fill box or item number 15 in. If we do not know what the date is, then we can go ahead and leave item number 15 blank. Box number 16 is where we indicate the dates the patient is unable to work in current occupation. This will indicate dates that a patient wasn't able to work if we're doing a workman's compensation claim. If it's not a workman's comp claim, we're going to leave item number 16 blank. Item number 17 is where we indicate whether or not the patient was referred to us by another physician. This usually occurs when a patient is referred from their family practice physician to a specialist for a certain condition. If the patient was not referred to us, then we're going to leave box 17 blank. Box 17B is where we would put the National Provider Identification Number of the physician who referred the patient to us. Since I've left box 17 blank, I leave item number or box 17B blank. Item number 18 is where we indicate the patient's hospitalization dates related to the current services. If I see a patient in the hospital, then I need to indicate those dates that the patient was in the hospital so that they know that the patient was actually seen during their stay. If the patient is seen in the office, I'm going to leave box 18 blank. Item number 19 is going to be left blank. Item number 20 is where we indicate whether or not outside laboratory services were provided. When we talk about outside lab, what we're talking about is that if there was lab work or some other test that was done in the office, and if that particular sample or specimen has to be sent out to a laboratory and it's not done within the facility, then I'm going to mark this box yes. If I mark yes, I have to indicate what the charges are for sending that out. If any lab work was done in-house or if I didn't order any lab work, I simply mark that there was no outside lab done and I can leave the charges blank. Item number 21 is where we indicate what the diagnosis of the patient is. We need to put ICD-10 codes in this particular box. Notice that I can put 12 different diagnoses in here, and we simply take that off the patient's encounter form. The physician will indicate the diagnoses. If the codes are not there, we'll need to look them up prior to completing this form. If I have diagnosis 1, it's A. Diagnosis 2 would go here under B. Diagnosis 3 would go here under C. So this particular patient was seen for an I 48.91. So that's what I'm going to indicate here. And we only have one diagnosis on this claim, so that's all I need to put. Item number 22 is a resubmission code. If I have to resubmit a claim because of an error or I filed one that I shouldn't have, then this is where I indicate that this is a resubmission. Anytime we submit a claim to an insurance company, there will be a reference number attached to that particular claim. So I need to put that original reference number here so the insurance company needs to know which one we're referring to. If I am resubmitting a claim because I made an error on the first one and I want to replace this original form that I sent in, I'm going to put a 7 here in this box right here. If I filed a claim in error and I shouldn't have filed that claim, then I'm going to put 8 there, which tells the insurance company that they need to cancel that first claim and file this one instead. Item number 23 is where we indicate whether or not we have had to have a procedure authorized prior to performing it. When you call the insurance company and you tell them that you're going to do a procedure and they authorize it, they're going to give you a code and you're going to document that in the patient record. That's important because I need to indicate that I got the prior authorization number when I file that claim. The insurance company documents that they did give us a prior authorization number, but it's our responsibility to make sure that we tie that prior authorization number to the claim. If we do not put that prior authorization number here on this form, they will deny the claim, saying that it wasn't pre-authorized as per the policy agreement.